Hi, everyone. Welcome back. This is season 5 of the Holistic Pharmacy podcast, and I am super excited for the new format we're going to be bringing on. So I'm going to be actually collaborating as part of a team of pharmacists, and I'm going to be bringing you guests each week in addition to regular co-hosts of special episodes. So we're going to be featuring things like the journal club of the latest research and information, covering hot topics and natural medicine topics, as well as pharmacy topics. And we will also be featuring a functional medicine section where we're going to explore some interesting topics as well. And we're going to be interviewing subject matter experts of all walks of the healthcare industry, not just pharmacists. So I'm super excited. Welcome back to the show. I know we took a little bit of a break. So today we're just going to kick off season 5 in our inaugural episode with Dr. Lauren Castle and Dr. Jenna Carmichael. So these will be my two superstar co-hosts moving forward. And you've already met Dr. Lauren Castle in season 2, episode 13. I'll link to that in the show notes. She's the founder of the Functional Medicine Pharmacist Alliance. And she's going to be regularly hosting the functional medicine segment of this podcast. And Dr. Jenna Carmichael, I'll actually be introducing her more in depth in our next episode, where we do a one-on-one interview with her and her journey. But just to say a few words, she is a holistic oncology pharmacist and health coach. So I'll just let them introduce themselves really quickly, and then we'll get into today's really cool topic.
Awesome. Thanks, Marina. I am super excited to be back on the show. So much has changed since our episode had aired, and it feels like a lifetime ago. So very excited to be co-hosting with you and bringing more information about functional medicine, of course, which is my passion, and bringing on some really exciting guests to share, what they're doing with functional medicine, because we still have so many questions out there about what is it? How do I do it as a pharmacist? Where do I learn more? What different roles are out there? Are there jobs available? Can I do this in retail or hospital or consulting? So lots of different questions, and we're going to explore all of those in the functional medicine segments.
Awesome. Well, I'm so glad to have you on board. And those are definitely the questions I get the most from other pharmacists. And I know you are a great resource, and FMPHA is a great hub of resources for that. So Jenna, would you like to introduce yourself?
Yes, hello. I'm so excited to be here as well. I'm Dr. Jenna Carmichael, and I have experience in the hospital space, in the oncology space, and as a previous residency program director, I am happy to host the Journal Club section of the podcast. And I am still learning functional medicine myself. I'm learning these holistic modalities. And so I'm really excited to learn along with all of you, to read these articles and to pick them apart and really see how we can apply these concepts to our clinical practices and to our own lives as well.
Yes, I'm so glad to have you on board and to have you spearhead that. So today's topic, we wanted to first lay down the foundation and the groundwork for the remainder of the season, because the title of this podcast is Holistic Pharmacy Podcast, right? So we wanted to define what that really means, and also bring in some other terms that are often bundled together, like integrative and conventional, complementary, alternative, allopathic, all these different things. And then of course, functional medicine. So what is the common ground among all these terms, and how can we differentiate among them? And where do we use one term versus another? What's appropriate? So I'm going to just share why I chose to stick with the name Holistic Pharmacy Podcast rather than change it to something else, because I feel that that is the all-encompassing term. So when I think about health and how we should practice healthcare, I think holistic is the term that encompasses all of these ideas that I just mentioned and all these terms into itself. So holistic to me means that it is encompassing of all views and walks and spectrums of health. It looks at the whole picture. That's why, holistic, it has the root word whole in there. So that's WHOLE. So it's looking at the whole body, and not only the human body also, I want to say, but also on the grand scheme of things, the body, the macrocosm that we exist in. Because for me, health is also about relationships and how we relate the parts of the whole to the whole. So we can think of the body as a whole, and of course, the WHO definition, remember, that classifies health as this combination of the body, mind, and spirit, right? That triage, that through those three things is what needs to come together for whole body health. It's not just the physical body that we often focus on. So it's that trinity, right? That trinity of the whole body, mind, spirit, and then also how we relate outside our body to our outside world, which will include things like our relationships, our environment, how we take care of the larger earth, and how the earth can then in turn take care of us. So that's why I feel like it is the perfect definition from which to start a conversation about how to approach health. And the other terms are just ways that we can talk about the conversation, how we can contribute to the conversation, and methods that we can apply for supporting the whole body, the whole mind, the whole spirit, and everything that I just mentioned. So that is how I want to start off the conversation, and then I'll open up to you ladies about any comments about holistic or the other terms that you often hear thrown about.
Yeah, so I also thought a lot about this as well whenever I first started on this journey. I remember learning in pharmacy school in I think it was our OTC class, and we had one lecture, and it was about complementary and alternative medicine, CAM. And I was like, okay, so there's complementary, where it is, complementing our conventional modalities. And then there's alternative, which is like indicating that it's an alternative to the conventional modalities. So that's kind of makes it sound like, where people start thinking about like pseudoscience or something like that, like it's alternative medicine, it's not real medicine. So I didn't really like that term. And then that's where they also started saying, if you combine conventional and complementary and alternative, then you get this integrative medicine where you're integrating all three of these different areas and having this healing oriented body, mind, and spirit approach that's combining conventional and CAM. So I definitely see, a lot of the word integrative being used as well, which I think is a really great term. And I think, when you compare something like holistic and integrative, I think there's a lot of similarities and overlaps there with that. And then I got introduced to this concept of functional medicine. So then I was like, well, what's the difference between holistic or integrative and functional? And so as I started kind of researching and studying the difference there, what the Institute for Functional Medicine, which is one of the bodies that helps to certify practitioners in functional medicine, they kind of boil it down as that all functional medicine is integrative. So you're still going to be doing all of these different types of modalities, which is kind of where it comes down to, is it's just a difference in modalities that you might be using and the approach that you're using. But on the flip side, not all integrative medicine is necessarily functional. And so an example of that might be that someone is simply substituting a supplement for a drug to mask a symptom rather than treating the root cause. So if you're truly practicing in a functional medicine way, then you're actually going to be digging a little deeper to find out the cause of whatever condition you're treating, as opposed to simply using a quote unquote holistic method to treat the same problem without actually treating the root cause. So I think that is kind of a way to sort of differentiate it. But certainly I think anyone would agree that, if you're a practitioner and you're using any of these terms to describe your practice, it all comes down to what you resonate with and how you want to describe what it is that you're offering to your patients, whether it's holistic, functional, integrative, complementary, alternative, any of those topics or labels really is all it is, can work for you. And it's just being really clear about ultimately deciding how you want to practice and what you want to offer to your patients, regardless of what label or affiliation you choose to associate yourself with.
Yeah, absolutely. I also think of it in terms of like a pictorial diagram where there's like a Venn diagram thing going on. And there's, like I mentioned, like for me, holistic is the all-encompassing term. And then maybe there's some conventional even crossover for that can happen, but a lot of it is not crossed over. And then functional medicine and is part of that, of holistic. In integrative for me is similar to, I guess, complementary, whereas alternative that you mentioned is exactly how I think of it, is like something that you use instead of or in place of what we think about as allopathic or conventional. So there's an implication that they can't work together. It's either one or the other. You have a choice. Whereas complementary, you can add on like an adjunct therapy. So it could be something from the alternative realm, but you choose to add it on or slap it on. And then integrative is like the combination of like a complementary and a conventional treatment together. So there's like that center of the Venn diagram forming. And then functional, like you mentioned, is about a system, really. It's like a system of looking at how do we apply the functions, the biochemistry, the nitty gritty of what we know in conventional medicine, and how do we apply it in a holistic way where we look at all the factors working together. And there's like basically a system around that. So it's a systemic approach to how we actually go about applying this into healthcare.
Yeah, I think that sums it up perfectly.
So Jenna, anything to add? And I also know that we also throw words around like natural medicine or naturopathic medicine. So like where does that fit in?
Yeah, I agree with everything. And so I feel like I think when I look at this, I think of kind of my own journey into going from straight Western allopathic medicine into more of a holistic standpoint for myself. That was through yoga, meditation, stress management for my own health and wellness. And then finding that the things that I learned for myself were very useful for my patients when I was talking with them about helping them with their own stress management and their own dietary ideas. And so that meant that I had to learn more about what those things meant so that I could help my patients better. But one of the things that I really think in my mind kind of differentiates what we would call holistic medicine and integrative medicine versus say traditional allopathic or Western medicine is the emphasis on emotional health and mental health. I feel like our Western allopathic system does not delve into how important it is to have robust mental health and wellness compared to systems like Ayurveda or traditional Chinese medicine, where in those systems, they actually think and feel that emotions reside physically within certain organs of the body. And I have really resonated with this idea that anger is in your liver, and by cleansing your liver, that helps deal with anger and frustration that you feel. And to me, that is a very good example of how you can utilize these types of modalities to help yourself, but kind of differentiates what I'm thinking of when I say Western versus holistic.
Yeah, so why don't we also define what is allopathic, what is conventional?
So for me, being, raised and, and trained in that area, I would say that's, your traditional hospital healthcare system that has your pharmaceuticals along with surgery and other sorts of things that are amazingly wonderful and life-saving in emergency situations. So if you're in a car accident, if you're having a heart attack or a stroke, we definitely am very, very grateful for the fact that we have Western allopathic medicine, because they have prioritized this idea of when it is really important to make sure that we time things appropriately, we're going to get those things down right. And so we know that in the emergency room, it's time to needle when we're talking about stroke victims and coming in, so that way we can make sure that they have a good result. But when we're talking about holistic health, in my mind, that's more about prevention, having that healthy lifestyle, so that way you have a good function throughout your lifetime, and being able to enjoy the years in your life, not the life, or have those life in those years that you have.
Yeah, so when I think about allopathic, traditionally, that there's even differences in that in like mainstream medical, right? Because allopathic typically is associated with an MD, a medical doctor degree, whereas there's also osteopathic, so doctors of osteopathic medicine. And my understanding kind of there is, the allopathic model is more focused on treating the disease, whereas an osteopathic model is more treating the patient, and also does have a bit more of hands-on approach, as well as kind of that body's ability to heal itself. And so if you treat certain aspects of the body, it can actually facilitate healing. Whereas if you're using, a strictly allopathic model, then we as the practitioner are having to intervene with medicine to create the change that we need to see because something is not working correctly.
Yeah, absolutely. The way I think of it is, even the word tradition to me implies like what has always been done versus what is now being done. So allopathic or conventional to me is like, what is the standard for care currently, right? But traditionally, it is actually not the model. Like, that has changed. Whatever the standard of care was has always changed with the times. So it has never been, the all-encompassing standard of care through all times, because we're always evolving and there's always some different standard of care happening. So traditionally, I would say actually those, what Jenna mentioned, like traditions, like Ayurveda, like TCM, basically every nation that evolved and lived through the ages and whose historical records we actually get a chance to go and look through because of how well preserved some of these are. So we can date it back to ancient Egypt and, beyond that. So every country, every nation, everywhere that people lived across the globe through the ages, they developed their own systems of care and healthcare because they cared for themselves, for each other, and they wanted to support their health, and they wanted to make sure their loved ones were around for longer. And then there's records of things like even breast surgery being done in ancient Egypt from back then. So we have been evolving using all the tools we have, setting the foundation of health, as we think about in holistic medicine, where it is that foundation and that those pillars of health and the non-negotiables and the prevention. But then we also have the emergency medicine because emergencies happen. So both sides of the spectrum need to coexist to serve all of us that can have anything happen at any point. But I do believe that, traditional systems and models were more balanced in terms of how much they focused on one versus the other. So the way I see it is, we have this scale, right? We always have a balance in health and in just concepts in general. So when we focus our resources on the prevention, we can help a lot more people, and we can potentially prevent some of the emergencies that keep cropping up. And if we focus the other way, which is the way currently I feel our allopathic and conventional is set up to focus on that emergency more, then we don't give the general population a chance to be healthy without intervention. So we were waiting until that last moment, until an emergency happens, and then we treat them. So I would say traditionally, people would find ways to take care of themselves and to implement self-care modalities, utilizing things like plant medicine that they could easily access without having to go to a hospital or to like an MD or somebody that has more qualifications than themselves. So it's about each family, each person having the autonomy and the I want to say the body wisdom, maybe having some kind of secure way to trust their body's healing abilities and to utilize what's around them, what's directly accessible to support that healing before an emergency happens, that where they do have to turn to somebody with the credentials and that needs to help them and step in. So if we properly balance our resources among these different traditions, we can really build a very strong system.
Yeah, I love that thought. There is so much that really does go into more of a preventative model. And I think about that too, where this is also kind of an area where functional medicine, I think, really does deviate from conventional in some ways, is that even like the labs that we look at, we'll look at the same set of labs and come up with a totally different interpretation of them. So that just speaks to, again, at what point are we saying, okay, well, we're, preventing diabetes because we're worried about your A1C moving from a 6.4 to a 6.5. Well, really, you're starting to see insulin resistance more around like a 5.5 or even earlier. So there's so much room there for interpretation in terms of at what point are we going to start making changes, and again, that's where you said like that body wisdom, it's going to look different for every person. And at times, I think that I want to see integrative and functional and holistic medicine become the standard of care, right? Like that would be the dream. Like if everyone embraced this way of practicing in healthcare, that we could prevent so much disease and suffering and pain, but yet at the same time, recognizing that if that were to be the case, is every patient ready for that? Is every patient truly going to be able to accept that guidance and that type of early intervention to say, right now we see these signs of disease very early on, and we recommend these specific lifestyle changes, because clearly it's not at a level that we would start intervening with drugs or, something of that degree. But we also recognize that not everyone might be prepared to start really making those changes. And so we do have to still individualize it. based on, what each patient and what each practitioner is really ready for. So I think there's just so much education that, we still have to do with our patients and with our own individual professions to just help bring awareness around, these different thought processes and different modalities and different ways of practicing, so that everyone can kind of come to terms themselves with what they believe, what they feel comfortable in, and what they're willing to commit to. And I also am a huge believer that baby steps are so important. So it's also very easy for someone who might be listening to this conversation. Maybe they're new to holistic or integrative or functional medicine, and they're like, whoa, I did not know it was this complicated. Like, why is it like this? And just knowing that it's okay to be where you are and to take your time in learning new things and taking your time to trying things. I think Jenna talked about that as well, for herself, having things that she learned that, and is still learning, that she is integrating in her own life. And I think that is probably what I find is most interesting about all of this, is anyone who is a practitioner who's on this path, that's on this journey, that they also are walking it with you as a patient themselves, because it is not something that you really can just learn in a textbook. There is so much of it that comes from actually learning it through living it. So I think that's something else that just really sets this type of care apart from the traditional medical model, because for most practitioners, you're going to hope that you never have to be on the same drugs that you're prescribing to your patients or undergoing a surgery that you're recommending to a patient. But certainly, we all know that we need to move more. We need to eat healthier. We need to sleep better. We need to connect with our friends and family every day. We all know that we need to do those things. So that's what I think makes these modalities so much more fulfilling and realistic. And that's really encouraging to me.
Yeah, I think there's a lot of power in that. You are your own first and foremost patient walking this journey. And I often think about, the level of evidence, right? We have these degrees in journal clubs, for example, of like how, what's the power of this study and this number, and, the number needed to treat. And we look at the numbers and we look at the rating of the evidence. But when you yourself are that case study from the least, trusted source of evidence, it actually becomes the most important source of evidence when it's you, when it's personal, when it's your family member or your friend. So, the power of one does exist, and it's very important to individualize our approach and to also take into considerations the patient's or the client's preference and their values and their belief system. Because the other thing that I've noticed is the placebo effect can be very powerful. And I say, why not harness that, right? If somebody believes something, why don't we encourage that for better outcomes? So in order for us to change our belief systems and values, I think what you said is exactly right. Education is key. Knowledge is power. So in order for us to draw any kind of conclusions, right, we need to gather more information. We need to put those observations down and study them. And science is always changing and always contradicting itself and finding new information and new patterns. So before we make that judgment call of what is the best model and what do we recommend as the best course of action, we need to examine the existing evidence in front of us. So we can't really deny something without first studying it. Me and Jenna were having a little talk right before the recording about how in pharmacy school, if you're a pharmacist listening to this, most likely you've been taught that there is no value in the natural medicine world because supplements are not tested by the FDA and they cannot be trusted. And there's no evidence behind stuff. If you go on PubMed, there's not too much evidence on natural substances there. But at the same time, we're taught pharmacognosy and how we develop drugs from plant constituents, from phytochemicals. So it's like, so if there's no value, but how come we're inspired by them? And so it gets you thinking like there's some kind of discrepancy. So in my opinion, we cannot deny or negate something out of ignorance. Like we have to actually go and look at the evidence before claiming there is no evidence or that evidence is not powerful enough. We actually have to go the extra step and examine it and not just off the bat, say, no, this can't be. I wasn't taught this in my med school or my pharmacy school.
And I think to me, that's one of the hallmarks of this whole experience is this being able to be open-minded and to be able to find new evidence, change your mind from what maybe you thought before, and to really just allow the majesty that is the natural plant world and the universe in general to just kind of to wow you. I think that's one of the things that I've learned in this experience has been just to be open to the amazing opportunities that come through plant medicine that, I can teach to other people, which I love. And I think that it's just learning and being open to learning. And of course, as pharmacists, that's part of our job description, I feel like, is to be able to constantly be up to date with the newest, greatest, whatever is out there in terms of guidelines and medications and things. And this is kind of the old news, the things that have been around for so long, that the tried and true things, because obviously if they have been used for hundreds of years, they have to have some value to them.
Yeah, I agree. I think there's a different level of evidence. Like we say we valued the clinical studies and the RCTs and, we rate all of that. But when we think about, like I mentioned, personal experience and how powerful that can be in changing our minds and our belief system, because we literally are experiencing it, we can't deny it. Or, examining something that has been around for generations and still is useful and still can be applied today. So it's kind of harnessing both. So I also think about conventional medicine as bringing out the big guns, right? So it's great for when you actually need the big gun, but all the small, simple things that we mentioned as like going into the foundations of health, they're actually not that simple to implement because as a whole, as a society, as a general, way that we all live, we don't really value them. So if we just shift our perspective and our value system, and again, that's easier said than done, but that is key, so once we focus on something and hone in and give it the importance and the priority that it needs, then we can expect to see results. We again cannot just dismiss it without trying it out, without applying it as diligently as we would a drug therapy. Even drug therapy, you need to take it every day for it to work. Most of the time, unless it's a self-limiting issue, most of the time, what we're talking about today is chronic conditions and chronic lifestyle changes that need to be done. So yes, for the emergency situations and the self-limiting things, the big guns are appropriate, yes. But then for everything else that we see in our practices and even at the pharmacy, when we are dispensing the medications, a lot of them, over 90% is for chronic illness. And if you don't take it every day, it's not going to work. So the other thing about conventional therapy, I think, is that it does focus on diagnosing, which I respect, and it does focus on, identifying disease states and treating the diseases. However, it does not focus on what made the disease happen in the first place. Just like functional medicine, I'm sure Lauren will tell us, focuses on root causes, right? So unless you identify why is that symptom coming up, why are you in this disease state, why are you progressing to that? So Lauren was talking about trends, right? We're looking at the lab values and the trends, like where is this trending to? Is this trending towards supporting your health or getting off track? So unless we are noticing those trends early on and tracking them, and not just saying, okay, here you're in the red zone, here you're in the clear, nothing to worry about, you will miss stuff and you won't be able to bring out the little guns. You will need the big guns then. So there's like a hierarchy, right, of when it's appropriate to implement what type of therapy and support. So if we start out by meeting the basics and the foundation, we will need less of the other steps along the way in the pyramid. But again, you have to be as diligent about it and not just say, oh, this didn't work for me, I might as well just go try the drug because it's easier. Because it's not easier, because what the drug is doing, and again, many people will probably learn this through experience, or maybe people agree with me, maybe not, but what I've learned is that it's not easier. So I've learned that, introducing this new factor, whatever that is, whether it's a drug or an intervention that you choose, it has consequences. So with drugs, we as pharmacists know all about side effects. So we are aware that there is a risk for something going wrong, or something we didn't expect, or something that we do expect, but we figure it's a risk benefit thing. So we're going to go for it. So I think the reason why so many pharmacists are now interested in these new fields is because we see how much of our patients are not really benefiting from the quote unquote easy choice of taking a drug, because there are side effects, there are interactions, there are things that we don't want to see. And then there's escalations and elevations of doses, and there's, a lot of things that we wish that we can help them with, but the system that we have set up now, we have the drugs as like our main form of therapy, I would say. So the fact that people have to take this medication every day, and it may have potential side effects, and then we may even treat those side effects with other medications as polypharmacy, right? And then the thing is, a lot of times we mask our symptoms with those drugs. So the underlying disease may still be going on and even progressing, but we're not even paying attention to that because, hey, we're masking the symptoms. So the body's giving us those symptoms for us to turn it around and to help guide it back to health. But when we suppress the symptoms, we just forget that that's going on.
Yeah, I think you touched on a number of different things, things that are similar and different in how we approach things from a conventional standpoint versus, a holistic standpoint. I love the idea of like this pyramid, right? And they actually teach this as part of like the naturopathic approach to therapeutic order. And in a sense, we do learn this as well in conventional pharmacy or medicine, right? Things like start low and go slow. Like every pharmacist knows that, because we know, and we have to teach our patients this, that just because one is good does not mean two is better. And so it's very similar to apply that type of thinking with all of this and the bigger picture of all the different therapies and modalities and options that we have to treat, manage, or reverse disease, right? And so you think of that pyramid, and a lot of people just assume, again, that drugs are kind of like the baseline. But again, also in pharmacy school, first thing that we all learn before drug therapy is lifestyle interventions. So the problem, though, is that we really don't spend a lot of time either in pharmacy or medical school talking about what those lifestyle interventions are, or when we go out and we are practicing, being able to take the time to explain what those lifestyle interventions are to our patients. And I know Jenna has the health coaching background, and that is, the bread and butter of health coaching is the lifestyle interventions are so important, if not more important than any drug that you're going to actually take. And so I think that as we kind of look at all of that and think about that approach, what are all of these other foundations that we need to set with diet, exercise, stress management, sleep hygiene, but then, that's just the foundation for optimal health. And then we also have, what things can we do to help the body heal itself? What things can we then maybe add in to support systems in the body? And I think that is where, things like botanical medicine and plant medicine can come into play. Things that, aren't so much of the big guns like we describe our pharmaceuticals really being, but, using food as medicine, right? Even using different body work or chiropractic or acupuncture, all these other treatments that are much less invasive, right? And that have minimal risk, minimal side effects, if any. Why can't we use these as well? Then move on to maybe more targeted dietary supplements or nutraceuticals. Even things like hormone replacement, I think, is another area too, that again, it's something else that might be added in to supplement what the body needs, which, we can get into that in a future episode about functional medicine, thinking about what things do you need to add and what things do you need to take away or remove to promote health. But I mean, all of those different things can really come into play before we even get into pharmaceuticals or surgery. So we do inherently know these things, and we do think about that, but we just don't actually spend the time exploring them. And again, we talked about the evidence behind them, and that being part of the reason behind that, because we don't have all of these, robust double-blind placebo-controlled clinical trials saying that, chiropractic versus a muscle relaxer, or, an herbal supplement versus a pill. It is very hard to try and compare those different types of modalities. And so I love the thought process there, that the N of one is important. And I think if we help to recognize that and understand that we'll be able to see, hopefully over time, more, at least case reports coming in of these different modalities. And actually too, I'm super excited for some of the Journal Club articles, because Cleveland Clinic has a Center for Functional Medicine, and they've actually published at least 2, I think 3 studies now. One of them was in BMJ. They've looked at functional medicine approaches to rheumatoid arthritis as opposed to standard of care treatment. And again, there is evidence out there. It is becoming seen and actually documented to better support all of these different ways of treating chronic diseases. Whereas we thought that, the only way to do it was to add on a biologic or whatever the case may be. Well, now we are seeing through robust research that yes, food actually can work as medicine. So it's really exciting, I think, to bring all of this to the forefront.
I agree 100. And I think too, the thing that kind of keeps popping into my mind as I go through all of this is this idea of personalized medicine. This, in this age of genetic testing and all of these other things that we think of when we think of personalized medicine, this integrative approach, this holistic approach truly is personalized medicine because it takes into account what the person wants in their life, what their values are, what is important to them. Do we want to use herbal medications or do we want to use functional medicine supplements? They're probably going to do very similar things, but what is more important to you in your life? And that's the definition of personalized medicine. And that's really what this is about too, is what's important to that patient and their goals as well.
Yeah, I think conventional medicine also recognizes that it's important to be patient-centric. And we've been moving towards that, I think, in like the past decade or so to become, a team, right? A team of the healthcare team approach where different modalities complement each other and the patient is at that center and we are doing everything, for the betterment and for the best of our ability to take care of the patient. And that includes taking into account their value system and their preferences, and they have a say. And so that's where, again, I'm looping back to the education piece is so important because we won't be willing to make changes, whether it's, how we talk about non-adherence, even with medications. It's not actually that easy for patients to even remember their medications. Let alone like implement lifestyle strategies. So all of this requires first and foremost education to educate the patient on what we know. So we will say, here are your options, right? And this is why we feel like this is important and this might fit into your lifestyle. And then it's a conversation because they may have some other information to share or some new insight that we didn't consider about their lifestyle and their ability to implement these changes. So without asking and having the conversation, we won't know. So we're educating them, and then they're also sharing with us what's possible for them and what's feasible for them. And that's exactly where I think health coaching also really fits in, where we can be that member of the team that actually finds ways for the person to implement these recommendations. Because it's one thing, again, to just say, okay, this is what I think would help you. And then it's another thing to implement it. And the person needs to be motivated to implement it. They need to be organized. They need to be disciplined. They need to have the value that aligns, right? The belief system. They need to believe that this will help them in order for them to do it. Because if they believe it won't help them, they're not going to do it, right? Or they don't prioritize it, or they don't value it. So that, all of these things are so important, because even if we have the solution in front of us, we don't know if the patient's going to take it, and we need to support them in that journey and taking their own medicine and be their own healer, whatever that looks like for them. And so without this education piece and this conversation piece and involving everybody on the team, and first and foremost, the patient or the client themselves, and listening to them, that's another thing, right? Listening and having them be comfortable in sharing with us, creating a supportive environment, also being trauma informed, because all of these medicines that we discussed and all these modalities, a lot of them also touch on the mind-body aspect, right? So there's a whole mind-body medicine piece and energy work, which could be related to the chi or prana, or other systems describe them as different things. And there's quantum physics, like there's so much, but all of these can work together if we are aware of them, and if we listen to the patient's preference, plus we educate based on our expertise, and then we work all together.
Yeah. Oh man, I get so excited. Like even just how much more we can uncover in this first episode, talking about genetics and precision medicine, and then going all the way to the other side. I think about that as like you're literally on like the DNA level, and then jumping to the other side of like quantum physics and energy and how all of that plays into your health. I mean, it's amazing and it's exciting when you think about that. And, I think for patients that are feeling really trapped and stuck and overwhelmed and like hopeless in that they don't think they're ever going to be able to get better or heal from whatever they may be dealing with in their life, there are so many other paths and things that you still can explore. And that, like we said, it's one size does not fit all. It has to be individualized, and what works for one person may not work for another. So it's super exciting to think about that, in terms of just all the different options that are out there, and how, again, with like a functional approach, you talked about even just listening to our patients, right? There's so much that you can uncover by taking that time, and having these systems in place can really help with that, because, in a functional or integrative approach, we're also, still under all of these pressures and time constraints and everything else that we see with, conventional medicine. Those absolutely still can impact us in this area, but having systems in place to be able to gather all of this information, to organize all the information, to really tell that story back to your patient, and then listen and help to integrate even more of what they have to share, and then just help them in creating and ordering and prioritizing all of these different treatment strategies and things that we have to offer them, partnering with those health coaches to be able to actually initiate them and assess them and follow up with them, and then circle back around and track how everything's going. It's a lot. It can feel overwhelming, but it should hopefully be really exciting and inspiring for people to realize just how much we all have to offer, and why we need more pharmacists and more practitioners learning about these things and able to help implement them.
Yeah, so I want to thank you too for coming on and speaking on this topic, and just laying the foundation for our season and discussing the foundations of health and how to support that. And there's just so many more ideas that are coming to me about this now, but yeah, I'm so excited to keep exploring in the season. Any parting words or sage wisdom to share from Jenna or Lauren?
No, thank you so much for this conversation. We were kind of talking beforehand, we had to think about what holistic medicine actually means to us, because even those of us that work in this field and have it as part of our lives really had to think, how do I define this for myself? And so it was a great exercise for myself to think about this sort of thing as well. So I really appreciate that.
Yeah, and I am super excited for this upcoming season as well. I think we just scratched the surface of so many different topics. And so it will be really exciting to get to deep dive into all of these different areas. And so I know that there's going to be something out there for everyone.
Yeah, so I just want to wrap it up by saying that what I got from this conversation. So trust between healthcare provider and patient or client, however they prefer to be addressed or called, whatever term is more comfortable. So that's important. That's essential, right? For this to work, for healing to occur. And then education is very, very important on both sides as well, where we're equally educated on all options, and we are aware that there are options and choices, so that it feels good to go ahead with the option that feels best to you, after having that education and that research component. And then thirdly, having a system of support in place and implementation and follow through. So, and follow up. So these are, I think, three key components where real change and real healing can occur. And an open mind, I think that kind of goes without saying too. All right, so I want to thank you, Dr. Castle and Dr. Carmichael, for coming on, and I'm super excited to continue co-hosting with you and exploring holistic, functional, natural, every type of medicine under the sun.